Imagine a highly contagious virus spreading rapidly across the country, putting thousands of lives at risk. Unfortunately, this isn't a hypothetical scenario, but a harsh reality that the United States has been facing in recent years. The good news is that, after months of tireless efforts from healthcare professionals and public health officials, the Texas Department of State Health Services, DSHS, has officially declared the West Texas measles outbreak over. But here's where it gets interesting. The outbreak, which was one of the largest in recent decades, has left a lasting impact on the country's health landscape. As of today, a staggering 762 cases of measles have been confirmed in the outbreak since late January, with a whopping 2/3 of the cases affecting children. The outbreak has also resulted in 99 hospitalizations and, tragically, 2 fatalities in school-aged children. The DSHS Commissioner, Jennifer A. Shuford, MD, MPH, has praised the efforts of public health professionals and healthcare providers who work tirelessly to contain the outbreak, saying, "I want to highlight the tireless work of the public health professionals across the state who contributed to the containment of one of the most contagious viruses." It's worth noting that the outbreak was initially linked to a Mennonite community in West Texas, which raises important questions about the role of community outreach and education in preventing the spread of infectious diseases. And this is the part most people miss. The West Texas outbreak has kicked off what has become the worst year for measles activity in the United States since the virus was eliminated in 2000. But the story doesn't end there. In related news, Colorado has confirmed another measles case, this time involving an unvaccinated adult in the Grand Junction area who had not traveled outside the state, suggesting possible local spread. This new case brings Colorado's measles case count this year to 20, a significant increase from the previous decade. The Colorado Department of Public Health Environment has listed several potential exposure sites in Grand Junction, highlighting the importance of vigilance and awareness in preventing the spread of the virus. Meanwhile, in New Jersey, the health department has reported a measles infection in a traveler who came through Newark International Airport, warning that others could have been exposed. The person infected with measles is not a New Jersey resident, but the incident serves as a reminder of the importance of vaccination and international cooperation in preventing the spread of infectious diseases. On the international front, Israel has reported a second measles death in an unvaccinated 18-month-old child, bringing the total number of measles cases in the country to over 500 in the past 3 months. Most of these cases have been reported in unvaccinated children from Jerusalem and Beit Shemesh, highlighting the urgent need for vaccination and community outreach. So, what can we learn from these outbreaks? Firstly, vaccination is key to preventing the spread of infectious diseases like measles. The DSHS has emphasized that the best way to prevent getting sick is to be immunized with 2 doses of a measles-containing vaccine. Secondly, community outreach and education are crucial in preventing the spread of infectious diseases, particularly in areas with low vaccination rates. And finally, international cooperation and vigilance are essential in preventing the spread of infectious diseases across borders. But here's the question. What do you think is the most effective way to prevent the spread of infectious diseases like measles? Do you think vaccination should be mandatory? Or do you believe in a more nuanced approach? Share your thoughts in the comments below.